People often fear having a facelift will make them look unnatural. Dr. Barson is going to show you a more natural facelift that is done under local anesthesia today on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today we're talking about a truly revolutionary neck and facelift procedure that is done under local anesthesia and has a very short recovery time. Dr. Barson is joining us today, and he is the one that is the best at this Encore facelift, and he's here to answer some of our questions about the surgery. Dr. Barson, welcome to the show, my friend.
Thank you for having me.
All right, Encore facelift. Why has it got the title Encore facelift?
Well, traditionally an encore is where a stage actor or the cast comes out for their second round of applause.
Yes.
And so in this case, a woman, or a man, I guess, you know, their 20s, 30s, that's their first round of applause, and then they don't get another one. But if we can take them back to that, then they get the second round of applause.
Okay. Did you make that name up?
Yes, I did, actually.
I quite like it. At least you're honest about it. So what is the difference between an Encore facelift and a traditional facelift? So let's clear that up to begin with.
Well, in both we actually have to remove some skin to tighten it.
So it's a surgical procedure?
It is, but
Okay.
it's more minimally invasive because we're not cutting into the deeper tissues in the face in order to accomplish it. And the other thing is we're lifting more up, because if someone looks in the mirror and they want to kind of look a little better, they think, oh, you know, if I did this, it would just look so much better. And what they're doing is actually they're lifting up.
Right.
Because that's what looks good. But
well, because that's what we think, because we all know as people that things drop. So when we lift up the face, we're lifting and pulling back a little bit, aren't we?
yes,
When we look in the mirror.
in traditional facelifts, a lot of times will pull back more, and this is where you get the wind-blown look.
I got you. So what is the impression that you get when you do the lift? Is it a more natural look rather than it being tight?
Oh yeah, it's a lot more natural. We never have anybody look stretched or wind-blown or wind tunnel look or anything like that,
Okay.
because we're lifting in a proper direction.
In a traditional facelift, you're lifting and maybe stitching the muscle, okay, by lifting it up. Do you do that in this procedure?
We do lift the muscle up, but we don't do it by cutting out a piece of the cheek
Right.
down deep. We don't cut that out and then sew it together. We use what's called a suture plication, where we go under and we pull the fascia over the muscle up with the suture, and it holds it up without having to cut the muscle.
Dr. Barson, we know that it takes about 4 to 6 weeks for downtime for a traditional facelift. Why are you saying that it's less for yours?
Well, we're not going deep into the deeper tissues and doing a lot of surgery in that area. And because of that, you have less downtime, bruising, pain, and swelling. But that's primarily the reason we have a lot less downtime. And plus, we're using a technology where we have far less bleeding and bruising afterwards because we control it a different way.
Does that mean the results last just as long, or you're not getting the longevity out of a facelift?
No, we get the
compared
longevity.
to a traditional one.
You know, we have patients that we've got 10 years apart, and they look really great even 10 years later. Far better than they looked 10 years before.
Yeah. Dr. Barson, say 15 years ago, you saw a lot of tight facelifts. A lot of people were having this really stretched look. Why are you feeling that women are wanting this more of a natural look now? Does that mean they're hiding having the procedure?
No, and that's actually one of the big fears of having anything done to the face, because that's what's out in the public. And so if it's going to look bad, and people have seen, you know, the tabloids and, you know, people of fame and fortune that have had things and they turned out what looks to be terrible. And they think, well, what chance do I have? I'm just little people, and, you know, and they turned out bad. What am I going to do?
Yeah.
But with this,
That's everyone's fear.
yeah, and they don't want to look obvious, and so this is usually this much more natural way of doing it. We've had patients that have dramatic results, and other people don't really say anything to them because they still look sort of like them.
I like that. Just a little fresher is
Oh,
what you
yeah.
were saying 10 years ago. Thank you, Dr. Barson. Let's take a look at how you can use makeup to contour and shape your neck for a more youthful look.
Using a bronzer to contour your face and take 5 pounds off. Step 1. Apply foundation and powder first. Step 2. Using a matte bronzer, start at the top of the forehead and blend down to the temples. Step 3. Starting at the ear, draw a line under the cheekbone and blend. Step 4. Starting at the base of your ear, trace a line just under the jawbone and blend downwards. Step 5. Blend everything together carefully, making sure there is not any heavy lines. Step 6. Apply to the other side using steps 1 through 5.
Like us on Facebook for updates on the show and how to join the Younger You conversation.
We're back in the studio with Dr. Barson today, and we're talking about the revolutionary procedure called the Encore facelift. Interesting question posed to me. Can you have general anaesthetic instead of local anesthesia?
You could, but the technology that we've developed and that we use pretty much demands that you use the local anesthetic to get the results.
Which I understand where you're coming from, but what happens if a patient can't get past that and they say, Dr. B, I want to go under?
Well, we do have ways of making the patient more
relaxed,
sleepy and things like that without doing the general anesthesia. So they are basically much more sedated and get them through it. We've never had anybody in all the years that hasn't been able to get through it.
Okay. Do you often do injectables and Botox whilst you're doing this procedure? And what are the benefits of that?
Generally not. You know, if we're doing something more invasive, we like to let that settle out so that we know what the face is going to look like before we use a filler. Botox you could use, but the filler, you want to make sure that that's their face and it's going to stay pretty much that way before you go correcting it.
Okay. Dr. Barson, we have a lot of viewer questions now, and it's something that we like to throw to all our surgeons. One of them is there a non-surgical method to tighten the face and neck and skin?
Well, yes, and all of them involve heat.
Okay.
Now, the heat can be generated with a laser. It can be generated with a radio frequency device. It can be generated with focused ultrasound. These are the primary ways.
And we've talked about that before with you, because that's something that you like to specialize in. Do you think you get just as good a result from those type of methods as opposed to an Encore facelift?
No, and typically what I'll tell somebody is if the Encore lift gives you 100% correction, the non-surgical procedures maybe give you 20 to 25% correction.
All right, I'm glad you're honest about that. Another question that was sent to you is, I'm 35 years of age and I think I could use a full facelift. When is a good age to consider this procedure? At 35, and I want to say to you what everyone sitting at home is thinking right now, that's too young. In your professional opinion, what do you think?
It could be, but you know, we've seen people that look 20 years older than their chronologic age because of sun damage or habits like smoking and things that age the skin prematurely. So somebody in their mid-30s could be looking like they're in their 50s. Well, not too often, but it could be.
I'm leaving that right alone, Dr. B. Thank you for that. Well, now it's time to meet Tonya to find out why she wanted an Encore facelift and watch Dr. Barson perform this procedure.
I'm Tanya Rogers, I'm 51, and I'm getting a surface facelift.
Tanya was a good candidate because she wanted to do it. And that's actually as simple as it gets. Now we're just going to be doing our preliminary marking here. You know, we don't tell people what to do, we don't even recommend what to do unless they ask. And so in her case, you know, she's an attractive lady and she's noticing changes. All women do, even women in their late 20s start to see changes in their face. And it's a little troublesome, and the older you get, the more troublesome it becomes. And so, anybody that has those issues is a good candidate.
Actually, I'd been talking to Dr. Barson about it for quite a while, and just sort of hadn't been the right time for me to get it done. And I just realized sort of over the last year or so, maybe turning 50 did it, I'm not sure, had quite a few changes in my life, and I realized that when the children are growing up and you've got family at home, your main desire is to sort of take care of them and nurture them, and you sort of put yourself at the back a little bit.
You know, the process really starts with a consultation where we ask a person what they want, and if they have a certain thing about their face or their body that they want fixed, we talk about that. And then we go through the choices of things that they can do to accomplish that goal of fixing this or that.
Last year I had a granddaughter, and that sort of changed things for me. Never seen myself as a grandparent before, and I was very welcoming of it, love her to death, but it sort of changed, I think, how I looked at things, and my own physical sort of outward look doesn't match my inside.
We mark the area, whether it's on the face or the body, whatever we're doing. After we've done that, then we use our tumescent numbing techniques that we use for making the area numb so they can't feel anything. We'll start that. Turn your head to the side. You're going to feel a touch and a poke.
Dr. Barson, I started going to see him. I had skin cancer, and he was actually the doctor that caught it. And I was getting laser hair removal. And I go to him because he educates people when you go in. You never feel pushed to sort of do anything. And the whole staff there just sort of explains everything, all your options, and tells you how to do things.
After the commercial, let's check back in with Tonya to find out a little bit more about why she felt she wanted this procedure. Be sure to head over to theyongeryou.tv to stay up to date with all things Younger You.
The following footage contains surgical procedures. It may be too graphic for some viewers.
I don't get up in the morning and feel that I'm, I can't go out in public or anything like that. But I feel like before, when you have children at home and things, you make them your focus because you want to, not because you have to. And you feel a bit selfish doing anything for yourself. And you have a little guilt involved there with trying to sort of take care of yourself.
Really, a good candidate is somebody that will, wants to do the procedure and wants to look younger than they did before. And so when we do that, that's a perfect melding of desire and technology. This is called tumescent anesthesia. Tumescent means to swell.
I don't think that I'll have more confidence. I'm a pretty confident person. I work out in the public a lot, and I don't think confidence is really a factor. It's more self-worth, I think. You feel like you're worth it to do stuff for yourself. So I think the self-worth part of it is sort of taken, like I said, the guilt out of doing something for yourself. And so you make yourself feel a little more valuable instead of putting yourself on the back burner a little bit.
The problems with surgical procedures a lot of time is in the anesthesia. General anesthesia is a problem in a sense because it has some complications. When we use a local or tumescent anesthesia, it's much safer. As far as I know, when it's used correctly, there's never been a reported death worldwide in the last 20 years using this kind of anesthesia.
I think if it was anybody but Dr. Barson, I might have a little bit of a concern, but like I say, I don't ever feel like I've been pushed in any one direction, and for this, he explains everything really well. He keeps it very simple and tells you what to expect, and so I feel like I'm going into it completely happily and can't wait to see what the end of it is.
It's very simple. So if I take my hand and I go like this, that's a skin-only lift, okay? They say, oh, it looks great. Go with that. Well, yeah, but this skin is still attached to the deep tissue. The deep tissue does not want to be up here. It wants to be back where it was. It will literally pull the skin back down in a year or two. And you look like you did before. And so you have to pull this up, yes, but you also have to pull this deep stuff up. Because when you pull up the deep stuff, there's nothing to pull the skin back.
Well, I think everybody should look to themselves, really, and find out what they're comfortable with. I think it's just insecurity when you call out somebody else for what makes them feel better. I think you just have to be confident and secure in your own desires and what's good for you. And if somebody doesn't like it, then that's sort of their opinion and they can live with that. But I try not to be judgmental on anybody's point of view, whether it's, you know, on a personal level, what they wear or how they choose to do their makeup, or I might make a little mental note to myself, never do that. But for the most part, I think you just have to live with who you are and do things that make you feel better.
Well, when we pull up the deep tissues in the face, it kind of bunches up underneath the skin, and so what we have to do is trim it to make it flat, so there's not a bulge into the skin. It's a shaping technique, so that there's very little bruising or bleeding afterwards. And so we're working in an area with very little blood in it, so we don't have to worry so much about that. And people heal quicker after. So it's safer, it's cheaper, and we usually get a better result with a lot less bruising, pain, swelling, and downtime.
Yeah, I don't think it's necessarily about what I'm going to do as far as how it's going to change my life. It's just given me permission to embrace who I am.
So after we've made the incisions and we've made little pockets to put the stitches in, we put deep stitches in the cheek, the jowl, and the neck. And those deep stitches pull everything up from below, not the skin. And then we tighten the skin separately. And in those two procedures, we get the lift done. And it has a very long-lasting effect because we've done 2 layers, both the skin layer and the deeper layer where the fat and muscles are.
Moving forward, like I said, I'm 51, and I feel like you have that right at some point to start putting yourself first. And so I feel like it's just going to give me the ability to move forward with how I want to live.
Skin, once it's released, will shrink. And so what we do is before we do the skin suturing, we hold it in its place with some temporary staples, and so that it doesn't shrink. Thank you. Tack that there temporarily. When we come back, we take the staples out and put stitches in, and that holds it for the long haul for the healing process. If there's any extra fluid or something, it has a pathway to get out. Put it right there.
I feel very physically fit, especially for my age, I should say. And we go on lots of walks and lots of hikes, and we're spend a lot of time in the water and things like that, especially in the summertime. And I feel like this inside me and the physical me will now match the outside me.
When we get back, we'll check in with Dr. Barson and see Tonya with her final transformation. It's transformation time, so let's check out Tonya's before and after shots. All right, my friend Tonya, how do you feel?
I feel great.
Do you?
Yeah, fantastic.
Do you love it?
I love it.
Why did you want to do this?
I've been thinking about it for a while. After I turned 50, I just noticed that my insides and my outsides didn't match. You know, you sort of feel like you're never growing up on the inside, but on the outside it wasn't matching.
Dr. Barson, why do you feel our patient was the perfect candidate for this procedure?
Well, really, it's up to them. I mean, they'll come in typically and they'll say, well, I don't like this or I don't like that. They'll want to know what we can do, you know, and we give everything from the non-surgical, you know, through the surgical options, and then the patient decides, really.
Did you like the fact that he gave you those options?
Yeah, I always feel like I go in there with questions and they just give you an education. They're not trying to sell you on anything.
Tonya, have many people noticed the change in you?
No.
Is that a good or a bad thing?
I think it's good.
Okay.
Because I didn't do it for everyone else, I did it for myself. And I feel better. You know, I don't feel like I look as tired as I did before. I don't ever feel like I felt really sort of hideous or anything when I go out.
At least
But
you're
I
honest
feel-
about that.
Yeah,
You
but
still thought you looked pretty good.
That's right.
But you wouldn't mind a bit of a tune-up.
That's exactly what it was. It was just a bit of a tune-up.
Dr. Barson always says that, it's good recovery. Where they're cool.
Mm-hmm.
Be honest with me and everyone at home. How was your recovery?
I was surprised that there was no pain, and I would say I never took a pain pill afterwards. I was awake for the
love it.
recovery. I had minimal bruising, but it was gone in a couple of days. I had a little bit of swelling, but I had it done on a Friday, and I went back to work on Tuesday.
Dr. Barson, why am I hearing these type of results from your work? Minimal downtime, minimal bruising, and the facelifts that we've talked about, not just last year, but also this season, that you're getting that minimal downtime. What are you doing different?
Well, it's not as invasive. The technology we use is a little different, and we're not cutting through the deeper tissues, and that cuts down the downtime. But we're still getting pretty much the same results, and that's really nice. There's just a lot less intervention, and so we're not going as deep as some of the other facelifts. Yes.
So I think Dr. Barson said earlier on in the show that I asked him why did he call it an Encore facelift, and he said it's like the fantastic encore of a play. Come out and have a second showing.
That's right.
Do you? You're smiling. You're like, yeah
that's
I'm having an encore appearance.
That's right.
Do you really feel that way?
Yeah, I feel like that. When you go out and you meet everybody and you haven't quite put yourself together yet, you're just running in for one thing. I kind of I feel like now every time I go out that I'm ready to meet everyone.
What do you say to people out there watching you? How old are you again?
52.
Gosh, you look good, Dal. You really do look good. 52, amazing. What do you say to people out there who are watching you now, who are 52, and are sceptical about having this Encore facelift?
Well, I think go and have a meeting with Dr. Barson and his staff, because they will give you the honest opinion about what is good for you and what will work. But I think you have to, at some point, start taking care of yourself, because you get into the habit of taking care of everyone around you. I think especially as a woman, your children and your family, and sometimes it gets to be your turn, and you should do that with no guilt.
When did you decide it was your turn?
December?
A week before the surgery,
right.
Troy. Good result. You're happy, Dr. B?
I'm happy if she's happy.
Yeah, but we also said earlier on that you consider yourself a bit of an artist as well. Do you stand back and look at Tonya and think, I really did sculpt a perfect picture for what we were looking for?
Well, I can't really improve on what she basically is. What we can do is we can just take away the age and some of the processes that happen with aging and make them, just take her back to maybe what she was 10, 15 years ago.
And you say that a lot because that's really important. He's not trying to dramatically change your look.
Right.
He's just wanting to reverse the clock a little bit.
Yeah.
Well, congratulations. I think you look stunning.
Thank you.
And I love your accent too. It's almost as fabulous as mine.
Wow.
Thank you, Dr. B. If you're looking to tighten that lax skin in a natural way, avoided the undesirable pulled back look, maybe the Encore lift is the right option for you. For more information about the show and Dr. Barson over there at Surface Medical Spa, please visit our website at theyoungeryou.tv, and I'll see you next week. On the next episode, we're going to talk about eye rejuvenation and how a little work around the eyes can take care of that tired look you can't seem to fight. Dr. Thompson, Latisse. Everyone is talking about it. What is it and how does it work?
Latisse is a medication that was originally developed for patients with glaucoma.
The Younger You set provided by Madison McCord Interiors.